Hi, welcome to my channel OET Tips for Nurses. Today, we will see the role play about discharge of an elderly patient. Before that, please subscribe my channel and press the bell button. Let's start. This is your candidate role play card. Nurse setting. Hospital surgical ward. You have been nursing an elderly patient who had hip replacement surgery 3 days ago. The surgeon has seen the patient today and has arranged for them to be discharged tomorrow. You have been asked to discuss the discharge plan with the patient. Task: make sure that the patient has support from family or friends on a regular basis until he/she regains his/her independence. Ask if the patient has any other concerns about going home. Reassure the patient that the physiotherapist will provide education to the patient and family regarding patient mobility. Explain that the pharmacist will deliver medications before the patient is discharged. Explain that the patient will need to make an appointment to see the GP, who will check his/her wound and reinforce the dressing if necessary. Inform the patient to call the hospital if there are any major concerns such as excessive pain, despite taking medication, bleeding from the wound site, or an elevated temperature.
Good morning, my name is Mary, one of the registered nurses working in this hospital, and I'm your assigned nurse today. Just for the confirmation, could you please tell me your name?
Good morning, nurse. My name is Peter.
Okay, Mr. Peter, your doctor has decided to discharge you tomorrow. So I am here to discuss the discharge plan with you.
Oh, nurse, I am not confident enough to do my independent activities. So I am not ready for discharge.
I do understand your situation, Mr. Peter. Anyway, in order to get a clear picture about your condition, shall I ask some questions?
Yes, nurse. Please ask me.
Thank you for allowing me. Please tell me who will take care of you once after the discharge.
I am living with my son. He will be looking after me following discharge. But nurse, there is a chance of fall while showering or doing any other activities, for which I am really afraid.
I know how you must feeling, Mr. Peter. Don't be worried. Before discharge, your son will be well educated regarding your ongoing care and explain what are their needs for you. How does that sound, Mr. Peter?
The sound is good.
Do you have any other concern?
Yes, nurse. I am really concerned about walking around independently.
Yes, Mr. Peter, your concern is reasonable. Anyway, I will arrange an appointment with a physiotherapist. He will provide expertise guidance to you and your family regarding mobility. Is that okay for you?
Yes, nurse, but I have doubts regarding my medications. How long I need to take my medication and how I will receive it.
I can acknowledge your concern. Our pharmacist will deliver and explain about your medication. Each and everything will be discussed before your discharge. Are you following me, Mr. Peter?
Yes, nurse. Then, how will be looking after my wound?
I can perceive your concern. It is very important to take care of your wound. Avoid vigorous activities and care to be taken while showering. Try to take a balanced diet. Please make an appointment to see the GP, who will check your wound and reinforce the dressing if necessary. Is it clear?
Clear, nurse. May I know about follow-up care and length of time to heal?
Sure, Mr. Peter, I will inform you regarding this. The length of the recovery may vary according to the person. If you follow the suggestions properly, definitely you can be recovered from this condition as soon as possible. It may take 4 to 5 weeks for a complete recovery. In addition to this, please call to the hospital in case of any emergency such as excessive pain, elevated temperature, or bleeding from wound site. Do you have any questions at this stage?
No, nurse. Everything is clear.
Well, I hope that I address all your concerns. Shall I make the arrangements for your discharge?
Yes, of course, nurse.
I will do the needful for you. If you have any queries, please contact me. I am here to help you.
Okay, thank you, nurse.
Thank you for your valuable listening, Mr. Peter.
Thanks for watching.